Morning, everybody. Do we have anyone watching this morning? We should do, because it's not as sunny today, is it? It's been lovely this weekend as well, and then there was a storm last night. It was really weird because it didn't rain, but it was thunder, lightning, wind, but it looked like a really nice day. It was very strange. Right, we have a few people. Sarah.
Hi, Sarah.
Anne-Marie.
Hi, Anne-Marie.
Evie. Can you just comment if you can hear us so I know it works, and then we can begin? Yeah, we have a comment. Okay, we're working. So,
Brilliant.
hi everybody, thanks for joining us today. So I have Emma Goffe from Emma Goffe Family Osteopath. Some of you may not know what osteopath is, so she's going to talk a little bit about it, how it can help, and just talking generally about mummy and baby's health, well-being, answering the usual questions. If anybody has any questions at any point, as usual, pop them in the comments and I can read them out to Emma. But yeah, other than that, Emma will just talk to you about it all. So over to you, Emma.
Thanks, Jade. Yes, hello, I'm Emma Goffe. I am a registered osteopath and have been since 2011. So this means that I treat people of all ages, but I particularly specialise in treating families, so mums and babies, older children and teenagers as well. A lot of people probably, if you haven't seen an osteopath, don't know what osteopathy is. So it's a manual therapy. This means that we generally use our hands to apply some treatment to help you feel better. It's aimed at decreasing discomfort and pain, improving mobility, and increasing general well-being. We use a variety of different techniques to do that. So we might use soft tissue work, we might use gentle articulation of joints, so moving a joint through its range of motion. And when we're working with babies, we often use something called cranial osteopathy, which is a very gentle form of osteopathy, quite subtle, but very effective in babies. And in fact, I use it with all my patients. The kind of things a lot of people may have heard of osteopathy in relation to back pain. That's usually what we're most famous for. Neck pain, things like that, other joint pains. But we also work with the whole body in general. So that means that we can have an influence on all of the systems of the body, particularly helping, obviously during pregnancy and things like that. We're looking at helping with joint pains, getting backache, hip pain, pelvic pain, things like that. Very common. Getting muscle spasms as your kind of posture changes, things like that, helping reduce pain from that. If you're feeling a bit stressed out and things are getting a bit tight, we work on helping reduce tension, helping you relax more. Osteopathy can also help prevent headaches. So if you're somebody who's prone to getting migraines or gets a lot of neck-related headache, we can do a lot to help with that. And we also can help with digestive issues. And sometimes we get people, mums and babies who come in just because they want to have a checkup, basically, after the birth, make sure everything's fine, that everything's moving freely, and that they're in, no pain or discomfort. So those are kind of common things that we do see a lot of. Going to kind of how osteopathy, what things to look out for that might mean that you needed to see an osteopath or would benefit from osteopathy. So any sort of pain, particularly, joint muscle pain. As I said before, in pregnancy, that's often lower back or pelvis, hips, but then also sometimes upper back pain and just generally feeling tired. All of those things we can often help with. After delivery with new mums, again, any aches or pains. But also, when you get stuck in that breastfeeding or feeding posture and your upper back gets very stiff and tight, or you get a lot of neck ache, often mums get headaches after delivery. And we can help also look at the mechanics through the upper body and through the neck to help reduce those. with little babies, we see a whole host of things. As I said, often we see them for just checkups to make sure that everything's going well after delivery. But sometimes we have more specific problems that we help with. So things like digestive issues, as I mentioned before. So in babies, that might manifest as feeding difficulties, possibly struggling to burp well, getting very windy, maybe getting constipated, or struggling with their latch, difficulty with tongue tie or with breastfeeding, maybe only feeding off one side comfortably if they're breastfed, things like that. We also, in relation to that, looking at any stiffness the baby has. So are they comfortably turning their head in both directions? Because that's then going to impact whether they're feeding well off both breasts, and is also their neck position is going to influence, again, how well they latch. So if they're not comfortable being able to move their neck around, then that's going to influence how well that feeding session's going. And obviously I tend to work in collaboration with feeding consultants to help make sure you're getting the full package of advice on how to feed well, but also so that we're working on helping make sure baby's comfortable and that you're comfortable as comfortable as can be during the whole process.
Emma, can I just ask, you know how sometimes babies prefer one boob over the other? Could that happen to be with their neck problems, or would it be that they're more comfortable one way rather than preferring a particular boob? It could be with their joints.
Yeah, so it can be that what's happening is that maybe they're very comfortable turning their head to one side, and that maybe that's related to how they were positioned in utero for a while, or something to do with, the birth process, that maybe they've got comfortable in one position. And unlike adults, when you've got a stiff neck, we kind of keep testing, can we, how far can we go in the direction that we can't comfortably go? Babies don't tend to do that so much, so they tend to stick within their area of comfort. So they might try going there, and if it's not very comfortable, they don't have that range of motion, they're not going to keep trying. So they'll just work within their functional area of comfort. So that might be that they tend to look off in one direction a lot more. You might see it if you notice that your baby always seems to prefer turning their head to the right-hand side, and whenever you put them down and they're lying on their back, they always do this turning their head one way, and it seems to be, you don't really see them ever doing it to the other side. And, in all the photos, they're always facing one way. That might be a really good indication that their neck is a bit tight, or they've got some tension somewhere else in their body. And that's the sort of thing that as an osteopath we would definitely want to work with, because we want to have full mobility. And that's the sort of thing that, if they have that head preference, that could then impact, as you say, on feeding. And, so it might manifest as seeing them having a preference for one side, but it's because their neck is not comfortable to turn the other way, rather than because that side is necessarily, easier to get milk out of or anything like that.
That's quite interesting to know, because I know a lot of mums struggle with that, thinking, it must be the milk supply or something, but it might well not be. So that's good for everybody to know and look out for, I guess.
Yeah, absolutely. And that's a really common thing that I see a lot of, is babies, who tend to look one way and struggle with that. And there are tips you can do at home, during this, COVID time, and we're not necessarily managing to get out and see everybody, can't get hands on treatment. Things you can do at home if you do notice your baby's got a head preference. Set yourself up so that all the exciting things for your baby happen on the side they're less comfortable going to, because that will at least encourage them to keep trying it, and that should free up the movement gradually. So exciting things for babies generally are human faces. So make sure that you try and approach your baby from the difficult side. Set the cot up, or if they're, where you're intending to let them sleep, set it up so that they're going to be encouraged to look to the way they find harder when you start, when you go to pick them up or approach them. If you've got any sorts of mobiles or toys or anything like that, that they're set up again on that more challenging side for them. These are all things that will help catch their eye, and that will then help them keep trying to do that movement, which will mean that they keep trying to gain that skill, and that should improve things at this moment in time.
Could that hurt them at all? Like, if they were trying too much, and how sometimes we can just pull a muscle and we're like, and you get cramp or something, could that happen to a baby? Could you cause any damage basically, or is it perfectly safe to try that?
Because you're not doing any movement with them, you're not stretching them, you're not moving their head at all. No, this is perfectly safe. They are moving themselves within their own comfortable range of motion. So it's just to give them an incentive to try it. And you initially you'll see that they're still looking the way that they're more comfortable to look, but as they try it more, you should see that mobility getting better and them spending more time looking the other way. One of the reasons we want to make sure that they are looking both ways as well is because if they are lying facing just one way a lot, then that's putting quite a lot of pressure on that back part of the head that they're always lying on. So we want them to be moving their head around comfortably. And the other thing to do to help prevent any sort of flattening or anything like that, and again also help with their head mobility and neck strength, is making sure you're doing tummy time frequently with them. Always supervised, obviously, but that will help build up their neck strength and also build up this muscle control and give their neck another position to practice movement in, which is really beneficial. But yes, as long as you're not doing, you're not trying to turn their head the way that's suitable for them, it's perfectly safe to let them do that movement themselves. It won't cause them any harm and it shouldn't cause them any discomfort. So yes, head preferences, that's definitely something that is worth looking out for. And yes, the flattening, as I mentioned, if you're noticing that one side of your baby's head is getting a little bit flat, up your tummy time. Do it more frequently during the day rather than for longer periods. If your baby's not comfortable doing it for a long period, try doing it maybe every time you do a nappy change, 30 seconds, a minute, whatever they're comfortable with is enough. But just making sure you're doing it frequently will help take that pressure off the back of their head. Once they're able to move about with less, are able to turn and are able to support their head more, then they don't have to lie on their back so much, and that flattening will also be less obvious. But that's also something that we do treat and work with. Again, looking at if I was treating a baby with some head flattening or mild plagiocephaly, posh name for the head flattening, then I would be looking at making sure that there isn't any tension through the neck, that they are comfortable turning their heads both ways, and then we'd be doing gentle cranial work, so working on the head itself to see if we can encourage more expansion through the bones in the head to help that resolve.
And would you recommend that from birth, the tummy time?
So I would wait until the umbilicus has healed before starting tummy time. So you want that to have come off and their tummy button to be fully healed, no gunk coming out of it. But as soon as that's done, then yes, you can do tummy time. And obviously you can do tummy time on yourself. So you lie down, put baby on your chest. Dads can do this too. And just that action of your baby looking up to see your face, that's still tummy time. And that you can do from day one. So that's really nice. And do it skin to skin. It's really lovely for both of you. You get a nice bonding experience. You can do it after a feed. It works well.
Yeah, babies love that position, don't they? So
yeah, exactly.
I can hear your heartbeat, so it's comforting.
Close, cuddly, warm. Yeah. Often I see babies coming into clinic because parents say that they're unsettled, that they don't seem to be very content. They're maybe whinging a lot, or they seem to be very tight and they're not really. Their parents are kind of reporting they don't seem very content, struggling to help them settle. And so then treatment would be looking at gently allowing them to unfold, decompress gently, relax them, obviously checking that nothing else is causing any issues, that there isn't any underlying reason why they might be unsettled or tight. So we do a full examination to make sure that it is down to a musculoskeletal issue that we can help with. And sometimes we also see babies coming in, parents reporting that sleep's a problem. And obviously in a newborn baby and as a child grows, their sleep patterns change massively. So what might be appropriate for a baby who's, 3 or 4 weeks old is not going to necessarily be the same at 6 months or at a year or at 3 years, for example. And it is important to remember that when kind of going, oh, I'm not getting enough sleep, they're not sleeping enough, or they're sleeping too much, or, actually a newborn baby should sleep quite a lot, but often that will be with lots of gaps for waking up and feeding. But then you do usually expect them to start sleeping for slightly longer chunks and their feeds to be spaced out a bit more. If for some reason you're seeing a baby, or seeing a small person who seems to be waking very frequently and so sleep's very broken, not only is that really hard for the parents, but also it can be hard for the child, and you can get into that perpetual cycle of sleep deprivation for everybody that then makes it harder to get to sleep, etc. And again, this is a situation where we would check that there isn't any physical discomfort or physical reason why maybe this baby is struggling to sleep, that they haven't got undiagnosed reflux or silent reflux going on that's meaning they're waking up in discomfort regularly, that there isn't anything like that could be contributing. And if everything seems clear and there isn't any underlying issue that we need to refer on to a GP or a paediatrician, then we would do work to help again with relaxation, reducing tension, to help sleep patterns return to normal.
Is there anything people could do at home for this, or is this just something that you'd do as a professional?
So, particularly with the sleep, do you mean?
Yeah, like reflux, sleep, anything that you've just mentioned.
So with the sleep, trying to have a little bit of a routine is useful, if only for, partly for parents, so that you kind of know when you're going to be trying to go to bed, and try and get sleep when your baby is sleeping. If you have a baby who has a nap in the afternoon and that's actually their best sleep, maybe choose to have a sleep then as well, even if you can. But try and have a bit of a routine. So you've maybe got bath time, you've got some cuddles, maybe you do a little bit of baby massage afterwards, and then put them down to sleep, and try and have that. Obviously, in the early days, that's going to be hard, but it at least means that you're all kind of prepping for bed at the same sort of time, and you're trying to keep that routine. So hopefully, A, that will set in, and B, that will mean that that you're, even if you've had a bad night the night before, you're still trying to implement a sleep thing happening at a time that means you can catch up again, rather than it turn into a vicious cycle of lacking sleep again and again. Having baby close to you, often I hear parents saying that their child will only sleep on them. Once your baby's head control is good enough, using a sling can be really useful for that. During the day, if they're struggling to nap during the day and getting very tired, then if you can wear a sling and keep them close, you can still be getting on with doing things. Or even if you're just snuggled on the sofa, it saves you getting tired arms from holding a baby who's sleeping. So I find that's often a really useful tip. And everyone's different. Some babies are going to be absolutely wonderful, and others don't seem to need as much sleep and still seem to cope. So finding the right pattern for you and your situation and your family is really key as well. And if anyone has any specific questions about this, I'm really happy to answer them. It's kind of easier sometimes when there's more storyline to go on to be able to help give advice, etc.
Everybody's different, aren't they? So just
exactly.
Comment, guys, if you want to know anything like personal, please just comment or message me and I can read it out to Emma.
Great. When it comes to reflux, then first of all, I think it's important to mention that reflux and normal baby positing can sometimes be confused. So positing, or bringing up some milk after a feed, is considered normal within babies, as long as they are still gaining weight and as long as they don't seem uncomfortable when they bring that milk up. So if for some reason, if they start to be uncomfortable when they bring the milk up, or if they aren't tracking a growth chart well, their weight seems to be plateauing, or they've dropped weight, then that's when we need to be concerned, and we need to make sure that the weight's being monitored and that we're taking measures to help improve how well they're managing to keep the milk down. But generally, if you're seeing some positing or some reflux, as I said, positing's okay usually. When it starts to be a diagnosis of reflux, that's with the weight drop or lack of weight gain and the discomfort. Keeping your baby upright for 20 minutes after a feed. So, feed them, burp them if you can, and then keep them supported and upright on your lap. That gives their body a bit of a chance for the milk to pass further through the gut, and therefore it's less likely to come up when they're then put into a more reclined position. That's the kind of first port of call. If that's really not working and we're still seeing drops in weight, etc., if they're a breastfed baby, then generally the GP will advise putting them onto Gaviscon, which basically is a feed thickener. So it helps thicken up the contents of the stomach, making it a little bit harder for that then to be regurgitated. If you're a formula-fed baby, then they might start putting you onto more of the comfort formulas, etc., which are a bit thicker. And then if those things aren't working, there are other medications that they will suggest potentially. Usually, reflux as a problem is self-resolving within kind of 3 to 6 months, often quicker than that. But as an osteopath with that, I'd be looking at home management. So again, keeping your baby upright, possibly putting the cot on a very slight incline, no more than 15 degrees, but just a little bit so that they're a little bit more upright than flat. Obviously, you do that by lifting the mattress underneath. You wouldn't put anything in the cot to do that. With a hands-on treatment, I'd be again looking at the mechanics of the diaphragm, which is the muscle underneath your rib cage, which basically forms one of the closures of the stomach. So making sure that there isn't any problems with that, so that that's functioning as well as possible to help make sure that after you've had a feed, that closes properly, which would then reduce the reflux. Yes. Anything else that I mentioned that I haven't answered about the things we talked about?
That pretty well. Does anybody else have questions? There's a lot of people watching. I think everyone's just taking it in. It's probably new to a lot of people. It certainly is to me. So probably just like, oh, okay.
Shall I run through what you'd expect generally from seeing an osteopath when you come for your first visit?
Yeah, go for it.
So generally, and this is obviously in my clinic, but should be fairly universal, you would make your appointment. And when you come for your appointment, you'll have a few, basically a consent form probably to fill out, GDPR form, etc. And then your osteopath will take a detailed case history about why you or your baby is coming in. That usually lasts about a third of the length of the first appointment, and the first appointment is usually a little bit longer to allow for that. And the case history will run through, all of your current concerns about why you're coming in or why you're bringing your family member in. Any previous medical history, so, any medication that you're on, any bumps or scrapes you've had, any illnesses, things like that. If it's you're bringing it in your baby, we'll also run through your history of pregnancies and deliveries, and we will look at developmental milestones, things like that, make sure that we know when those happened, and run through any other help you're getting from anybody. So, are you still under a midwife or the health visitor? Have you been seeing the GP regarding this problem? Things like that. So we've got a really holistic viewpoint before we even examine you or your baby about what's going on for you, and that we really understand what it is you come for help with that day. We'll then run through a full examination. For some people, so for an adult, this may require us to ask you to undress slightly so that we can examine the area you're saying is causing a problem. So, making sure you're wearing some nice stretchy leggings and a vest top if you're at all uncomfortable being in your underwear can be really useful. This is so that we can have a look at, make sure there's no issues with the skin, but also so that we can look at movements well without any hindrance. If at all you're uncomfortable with this, then obviously say so. It's not compulsory. You absolutely have the right to say you're not comfortable with it, but it helps us be able to do our job thoroughly. With a baby, we'll ask you to undress the baby. We'll then run through a full examination. So we'll run through their normal primitive reflexes, check that they're all present and correct. We'll run through each joint, making sure that they're moving normally and that there's no tightness or restriction through there, looking at spinal mobility. We'll check their tummy, make sure that that's comfortable. There isn't any undue tension through there. It's not too tight or bloated or anything like that. We will check the diaphragm, which is that muscle underneath the rib cage, as I said before. And we'll also very gently assess their head, make sure that those cranial bones are all moving well and that their neck mobility is normal. We may also do other assessments depending what you've raised during the case history. So we may also listen to their chest or check listen to their heart. In a slightly older child, we might check their ears if you've been talking about ear infections, or if there was any concern or question whether they're teething or whether they might have an ear infection, we can look in their ears. So there's quite a lot that we also would assess with a baby or a child. We discuss the findings with you. So, often we will pick up some tension somewhere and we'll explain what it is, and if it's relevant to why you came in, explain that. Or tell you just that this is what we found and we'd like to do some work to help release it to make you and the baby more comfortable. Treatment will only go ahead if you give consent, and is generally very gentle cranial techniques for babies. In an older child or in an adult, then we might use some other techniques. So we might use some stretches, some gentle massage. We might do some joint articulation. So that's moving an area through its full range of motion. Or we might do some gentle work on the connective tissue to help balance the ligaments around a joint. We've got quite a lot of different tools that we use technique-wise. We'll also discuss management plans. So I want to see you again. I don't like seeing somebody once and then just having no follow-up. So we'll definitely book you in for another session or arrange a phone consult so that we can check in with your progress. Usually it takes 2 or 3 sessions to get to where we want to be with reduction of pain, etc. It's not, sometimes, you get that miracle session and you're pain-free and it's all wonderful. But often it takes a few sessions. You'll see an improvement after the first one, but it can take a few to actually get to that point of feeling, yes, I'm back to normal. This is because your body obviously compensates when you're in discomfort or when you've got tension. And so with the treatment, we work on the area that's causing the problem, but we also look at the whole body. So we look at the other compensations that might have started to happen. And it can take a little while to get your body back to being back to its normal position, because you're having to kind of take off the layers of compensation as well as work on the original problem that was going on. And we'll also offer you some home advice, so things you can do to help you and your baby while you're at home between the sessions you have with us, whether that's exercise advice or tips about how to manage whatever's going on around the house, lifting advice, positioning advice, things like that. We'll talk about those too.
I do have a question from Kyla. She says, can you recommend anything for pregnancy sciatica?
How do we know how many weeks pregnant you are?
How many weeks pregnant are you, Kyla? We can come back to that one. I've got another question somebody sent me. Do you check things at the hospital? You know how they do like your typical test for joints and things on the baby? Do you check things in more detail, basically?
So yes, so we have our own diagnostic set of criteria that we will run through with each baby. So yes, we do often pick up things that maybe weren't evident at that hospital check, because obviously everything's quite new and things can look a bit different. You know, I see babies of, you know, I think the newest baby I've seen is 2 days old, and I see people all the way through until they're, you know, in their 90s. But that young baby at 2 days old, I might see, and then at 3 weeks, I might pick up something different that hadn't been apparent earlier on. So we do, and at each appointment we see, we will reassess to make sure that everything is still progressing how it should. Obviously, what they do at the hospital is great, and we will, you know, as an osteopath, I always want to know, you know, if everything was normal at the hospital, what checks were done, etc., so that we know what that baseline is. But we will also recheck everything that's relevant to our remit, as it were. And if we have any concerns at all with any of the findings we have, we'll discuss it with you and discuss the appropriate management route. So whether that's that we're going to wait and monitor it ourselves, or whether it's that we want to refer you back to the paediatrician or back to the GP or back to your midwife, we will do that.
Kylie's replied, I've suffered with it since around 10 weeks. I've been to the GP and they referred me to a physio, but I haven't ever heard back from that.
Okay, so that's quite early on in your pregnancy to be getting sciatic pain. One of the other questions that I'd be, if you came into my clinic wanting to know, is whether you've suffered from back pain or sciatic pain in the past, whether you've been pregnant before, and whether you've had any injuries or anything like that to your back in the past. If this is the first time you've ever had sciatic pain, and if it's just going down one leg, so sciatic pain, first of all, let's clarify what sciatic pain is. So sciatic pain is pain usually originating in the back, travelling down the back or the side of the leg, and it needs to go to the knee or below to technically count as sciatic pain. We do sometimes get people having it to a lesser degree, where it maybe is just a little bit of an ache in the back and down into the top of the buttock. That's quite common as well. I would, if you're comfortable and you don't have any pre-existing medical issues that might be an issue, I'd start off by doing some gentle stretches. The muscles that you particularly want to try and stretch are going to be your piriformis muscle, which is one of your muscles in your buttock, your glute muscles, and your hamstrings. You're also, I quite like doing the child pose from yoga. I find that's quite beneficial. These are, I'm very happy if you want to find some videos for you to post or send you in a PM that I think would be appropriate. Or if you want to share more details with me in a PM, then I can give you more advice specifically to you about this. But I would start off with some gentle stretches, staying as active as possible. You know, generally back pain is worse and sciatic pain is worse if you're staying still or you're immobile. So try and make sure that you're moving about frequently. Make sure that you're not sitting for a long time on the sofa. Try and get up, move around every hour at least. Go for a 20-minute walk every day as briskly as you can, if you can. And if it's bothering you at night, then try pillows underneath your knees. So if you're sleeping on your back, raise your knees up with a pillow. Or if you're sleeping on your side now, having a pillow between your knees and being in that slightly more flexed kind of fetal position is often more comfortable for sciatic or back pain. Yes. So those would be my start-off tips. If I was seeing you in my clinic, then we would run through what your range of motion is. We'd run through some neurological tests to make sure that it is definitely sciatica and what the involvement is of it. And we would do some gentle work to help stretch, decompress the area, reduce muscle tension, etc.
Thank you for that. So yeah, Kylie, if you want to get in touch with Emma, she's also in the group, so feel free to just leave another comment and I'm sure she'll be happy to help you.
Yeah, absolutely.
You know how you just mentioned yoga then? Would you recommend that then for any sort of muscular pain through pregnancy or after? Because we do actually have a few yoga classes within the group.
I've seen, and that's fantastic. Yes, I think yoga can be really useful. I generally think, so in my practice, when I see people who don't do yoga or Pilates at the moment and they're having pain, I often suggest that they do one or the other, and I tend to advise it based on each individual. If you're a very stretchy, flexible person anyway, I tend to suggest Pilates to help strengthen everything up. If you're quite immobile, inflexible, maybe you haven't done a lot of exercise for a long time, you find it quite hard to touch your toes, I know with bumps, etc., that kind of gets out the window, but in your normal life, if you would find it hard to touch your toes, things like that, then I would definitely say doing some yoga is really great, because it will help improve your flexibility. And unless you are actually diagnosed as incredibly hypermobile, generally yoga during pregnancy should be absolutely fine. But sometimes I think Pilates, for its strengthening component, can be useful as an adjunct as well. And each individual obviously needs to judge it based on their own thing. But most Pilates or yoga teachers will be able to advise you if there's a particular move that you're struggling with or that you don't find comfortable, just raise it, say that you're struggling with it, and they'll be able to say, either modify it for you so that it's appropriate and comfortable, or that, suggest that you miss that particular move because it's not suitable for you. But generally, yes, making sure you're doing a regular exercise class during pregnancy can be really fantastic. It's also a really nice way of meeting other people and meeting friends, even on just a virtual meet format. You're still kind of getting in that feeling of having a little gang around you, which a lot of us are missing out on at this point in time. And that's a really positive benefit.
Okay. I'll look into Pilates classes as well for the group thing, because I've really looked at pregnancy yoga, so thanks for that little tip. So that should be coming soon, guys.
You're doing such a fab job with getting resources. It's amazing.
It's a full-time job, honestly. I'm busier than ever trying to get all these classes going. But it's great for everybody in here. So obviously people are just missing out on so much. So I just wanted to bring it all here, one place, and then it's just handy, isn't it? You don't feel like you're missing out, because you meet a lot of mum friends as well when you go to these classes and things. So even though it's virtual, people can still have that little sense of community. And
exactly.
I've seen a few people on here like make friends already and like add people and say, oh, when this is over, we'll go for coffee and things. I think that's lovely that it can all be in this group.
Exactly, and it's setting you up also for when we're past this situation and we get back into normal functioning real world scenarios, to actually be in the situation of kind of going, you've got that community, you can actually arrange to do a meet-up and then have, put a face to the name that you've been chatting with really well. Yeah. And that's a really big bonus as well.
Exactly. But yeah, there is a pregnancy class tomorrow, speaking of it, tomorrow afternoon with Narissa Fields. So if anyone wants to join that, I will post in the group about that later. But I think that's at 3 o'clock tomorrow. So yeah, please join. It will be beneficial to you.
Fabulous.
Are you all done, Emma? Have you finished everything?
Yeah, I was going to run through quickly a little bit about the qualifications for osteopathy, just so that people kind of know what training we've had. All osteopaths have undergone a 4 to 5 year undergraduate degree training. We're a registered profession, so that means that we've got a registry of osteopaths, and that by law being an osteopath is a protected title. Therefore, we're also an allied health profession, so we're recognised by the NHS England. A lot of osteopaths have also, like myself, done postgraduate training in paediatric osteopathy, which is quite an intensive postgrad training. And as osteopaths, we are all trained to diagnose, which means that you don't need to have a referral from your GP to come and see us. You can refer direct to an osteopath. It is a safe manual therapy. It's appropriate for all ages. And if you have any questions about it, then, just ask. If you want to check on the register for an osteopath in your area, you can just go onto the General Osteopathic website, and they've got a box that says, find an osteopath near me, and you can type in the area you're looking for, and it will bring up a list of osteopaths. If you're looking for somebody to see your baby, I would recommend following it through a little bit further and making sure that the osteopath you're choosing does have experience treating babies and children. Although a lot of undergraduate courses do contain paediatrics, this is obviously a quite different field to treating the adult, and it's worth making sure that the osteopath you choose has done further study in this area.
Yeah, you've got to be a specialist, haven't you, when you put in your little baby?
Yeah, exactly. You want to know that the person who's handling yourself and your baby has experience and has the skills necessary.
Somebody did ask, so you have just kind of covered that, but just to make sure we're right, you can just book straight with you. You don't have to be referred from a GP. So if
That's
somebody
right.
wants to come to you, they can just sort of book in directly.
Yeah, you can look up an osteopath and telephone or book online directly with them. If for some reason you have a pre-existing issue that you're concerned about having osteopathy with, then raise that when you make the booking, and the osteopath will discuss with you if for some reason they want to notify your GP or get any info from your GP regarding your particular situation, or if for some reason they don't think that osteopathy is appropriate for you. Again, they will be able to tell you that if you need that reassurance. Another thing that's just worth mentioning, if you do go and see your osteopath, if you are on a variety of different medications, it's really useful if you take your prescription slip in with you, just so that everything can be remembered and written down in your case notes, because again, that's something that we will ask about.
Brilliant. Thank you so much for that. Hopefully it's helped a lot of people understand what it is. I've definitely learned something. So and yeah, like I say, Emma's in the group, so please just comment it, because a lot of people will watch this later as well, so it won't be live, and I'm sure she'll be more than happy
on other people's.
Yeah. Brilliant. But yeah, thank you so much for your time, Emma, and thanks everybody for joining us. So enjoy the rest of your Easter Monday. Not that most of us are at work, but it's still a bank holiday, so enjoy. Bye guys.
Bye.